Cardiac Markers truly gives you the opportunity to hold healthcare in your hand. Our mission is to help the healthy people stay healthy. We have the opportunity to combat the two leading causes of death in our hands. We're developing an internet-based assessment to protect health, save lives, and reduce healthcare costs from basically anywhere. Our healthcare service will be available to consumers anywhere your mobile phone or computer will work. We will show you the specific market of people who will pay for our service. We will explain to you how this service will work. We will share with you why the service will be profitable, and we will demonstrate why March 1st, 2012 changes healthcare forever. We've certainly got a healthcare problem, which cardiac markers can help solve. March 1st, 2012, 10,000 baby boomers turned 65 years old. On March 2nd, 2012, 10,000 baby boomers turned 65 years old. On March 3rd, 2012, 10,000 baby boomers turned 65 years old. 10,000 more will turn 65 every day for the next 18 years. And as these 65.7 million people turn 65, it's estimated that 1 in 8 will have Alzheimer's. 43% will already have high cholesterol, and over 2.5 million will be in imminent danger of heart attack. Heart disease and cardiac arrhythmias currently cost $273 billion. That's 17% of our overall national health cost, and this is predicted to triple in the next 20 years. Currently, 1 in 3 Americans have some form of heart disease. By the year 2030, 116 million people, or 40% of the population, will have heart disease. Our healthcare system is set up to treat people with symptoms. Unless you have symptoms, you cannot get your health insurance to pay for a cardiac screening test. Yet many people are sick without these symptoms. There are two silent killers. Atrial fibrillation. 2.5 million people currently have atrial fibrillation. As we get older, our risk of atrial fibrillation increases. The longer you have atrial fibrillation, the harder it becomes to convert this arrhythmia to a normal rhythm. The longer you're in atrial fibrillation, the greater your chances of death, and the more costly it becomes to treat. Atrial fibrillation is the leading cause of stroke. Treatment of stroke cost $28 billion in 2010 and is predicted to have a cost increase of 24.9%. About half of these people don't know they're sick because they have no symptoms. The second silent killer is sudden cardiac death. It kills almost half a million people a year in the United States, 1,200 people every day, or 1 every 72 seconds. More than stroke, lung cancer, AIDS, and breast cancer combined. These deaths occur with no warning, with no symptoms. There are tests which can identify atrial fibrillation and cardiac rhythm problems before something terrible happens. You will see that people will pay for these tests. There are also tests to predict sudden cardiac death, but today they are only used by electrophysiologists and only after you've had a life-threatening cardiac event. The cardiac markers test puts consumers in the driver's seat, allows them to be proactive, and it will be available to everyone. We hired a company to do a national survey of consumers. We found that those with risk factors, particularly high blood pressure or high cholesterol, or both, were the groups most concerned about heart rhythm problems and the most likely to pay for testing. The American Heart Association states that there are 74.5 million people with high blood pressure and 35.7 million people with high cholesterol. Well, here is our opportunity. When we looked at the percentage of those who responded to the survey that they are very likely to buy our test for these top 2 identified health risk factors, which are high blood pressure and high cholesterol, we calculate our market to be 38 million people. Not only were these people interested, they were willing to pay. As we look more closely at the responses to a series of questions, we see that the middle 2 income groups show a willingness to pay between $300 and $400. Those who have high cholesterol are more likely to consider testing at $400, and the survey also stated that those who are over 50 and have high blood pressure are more likely to consider testing at $500. So this is our business model. Cardiac Markers Service is a quick and easy assessment to prevent stroke and sudden cardiac death. You'll purchase our service. In this example, it's online. The device shows up at your home. You follow the instructions and plug the device into your computer or mobile device. A patient tutorial comes on the screen showing you how to place the electrodes on your chest. After you've placed the electrodes, you're instructed to unplug the device from the computer and plug the device into the electrode wire connector. You will sit and record your heart rhythm for about 10 minutes. At the end of 10 minutes, you're going to unplug the device from the electrode wire connectors and plug it back into your computer or mobile device. The recorded data will be automatically transferred to our servers at our evaluation center, where our software will do an automatic analysis and generate an email report back to the customer. The device we are using is very similar to what a physician would use. Same high-quality recording, but simple to use, with automatic functions for easy consumer use. These devices typically have a manufacturer's suggested retail price of $2,000. We will be buying in quantities not experienced in the world of prescription devices. We're working with 2 manufacturers and have negotiated the cost of the device with shipping, packaging, and labeling down to $67. We have an exclusive license agreement to the QT variability integral algorithm, which is one of the most progressive pieces of intellectual property for proactively combating sudden cardiac death in the world. This piece of software was patented and developed by Ron Berger, MD, PhD of Johns Hopkins University. The amount of peer-reviewed data on this algorithm's ability to predict sudden cardiac death is impressive. While a standard Holter analysis can show a hazard ratio of 1.5, which translates into a 50% increased risk of death, the QTVI studies show a hazard ratio of between 2.0 and 4.6, which translates into a 100 to 360% increase in the risk of death. Studies also show QTVI to be comparable to the T-wave alternans without any of the challenges, such as a $40,000 piece of equipment, $150 cost for electrodes required to hook up to each patient, also the requirement to elevate the sick person's heart rate for 10 to 15 minutes. It's also interesting to note, as of June 2011, United Healthcare began reimbursing for the T-wave alternans test, which means they see value in the ability of software algorithms to predict sudden cardiac death. The Cardiac Markers business plan and forecasts are built on solid requests for proposals from potential vendors with expertise in their specialized area. The national survey was very clear as to the exact market of who will buy and what they will pay. The responses from potential distributors such as Walgreens and CVS have provided confidence in our sales projections and strongly suggest that multiple sales channels will be available. We have letters of commercialization support for a small business innovative research grant from potential partners. This shows a strong belief in our ability and our vision. Our team of physicians have committed to organizing presentations at national meetings to discuss the merits of QTVI as a strong predictor of sudden cardiac death. Cardiac Markers has the backing and support of some of the most renowned cardiac experts in the country, and has rights to some of the most progressive intellectual property for healthcare in the world. One of my associates calls this the Cardiac Dream Team. Ron Berger, MD, PhD, is the developer of the QTVI algorithm. He is the co-director of the electrophysiology lab at Johns Hopkins and sits on the medical advisory board for Boston Scientific. Ron got his MD from Harvard and his PhD from MIT in the same year. Wojciech Zaryba, MD, PhD, is the director of the Heart Research Follow-Up Program at the University of Rochester in Rochester, New York, is a well-respected world-class researcher and co-principal investigator for the Made It 2 trial. Wojciech is important to us as he is an influential physician who's a member of almost every editorial board for cardiology journals worldwide. Jean-Philippe Coudra, PhD, MBA, is the director of the Center for Quantitative ECG Analysis and Cardiac Safety. This organization has access to the worldwide research centers and to new ECG developments. Jean-Philippe is also a special agent to the FDA and has been instrumental in assessing information and guiding our FDA process. That's not the right slide. We are about to experience the largest explosion in the healthcare industry that this nation has ever seen. It is estimated that $1 in every $5 spent will go to healthcare this year. And wireless medicine is projected to be a $69 billion market in the next 10 years. Consumers are taking a lead in managing their own health. 231 million downloads of fitness and healthcare applications are expected by the end of 2014. Wireless medicine and the boomer revolution creates a tremendous investment opportunity. This may well be the new .com. You can see that we've highlighted sales for 5 years. We've also highlighted the net profit after tax and the percentage of profit after tax. This budget is based on a $10 million investment, which includes about $8 million in marketing for both the medical community and the consumer market. We are here to gain your support and financial backing to complete the initial stages which will help make this life-saving opportunity reality. We're looking to secure $500,000 in this first phase. The uses of that money will be to finish development of a working prototype of the automated ECG recorder and to have a fully functional service demonstration capability. We will also use the money to finish the 510(k) approval for the over-the-counter FDA designation. This will assist us in raising the next round of capital needed to complete the commercialization. We will be securing buy-in and credibility in the medical community, advertising, marketing, and distribution. We would be excited to share an equity position on an ongoing basis or to return your investment upon the second round of funding at a generous rate to be determined.